muscle length test. Go ahead and lie on your back. The reason we are doing this so specifically is because you really got to work on your stabilization. Okay, your stabilizing hands, you get a true sense of muscle length. Bend the knee. Okay, so as I'm bending the knee, whether you go through the knee or not totally depends on your patient. If they have any knee symptoms, don't go through the knee, then you'll go underneath the knee. Okay? But both are legal as long as the patient can tolerate it. But if what we're looking at is glute max, I want to lengthen glute max. Push the pelvic tilt for me. Is that glute max length? No. It is a little bit of glute max length, and it's a whole lot of posterior pelvic tilt. Right now, people use it as a stretch to stretch out their low back. Fine. But they are flexing their low back. So if you want people to stretch their glute max, or if you want to get a true sense of the glute max range of motion, you need to come in here, place your hand behind the PSIS so that you can stabilize the innominate, stabilize the pelvis. This is the stabilizing hand, this is the moving hand. I hug it in, I get my body mechanics, the front leg forward so I can do a weight shift. Okay, if I'm doing this, I'm going to be twisted, so that's no good. So I want, essentially, the headlights of the ASIS pointing in the direction that I'm moving. If I'm doing that, then I'm not rotated. If I'm here, and the headlights are pointing out in that direction, and I'm moving in this direction, I have to twist somewhere. So your check is, are my ASISs pointing in the direction that I am moving? I place my hand behind the PSIS and the iliac crest, grab a hold of the leg. I am using my weight shift so that my arm isn't doing all the work. I stabilize here, I hug in, I pull up. I now do the dance. The hand stays here, and the body moves over the hand. So that is a motor skill that you have to keep working on for all the techniques you're seeing. Stabilizing here, and then I weight shift and I come up. I'm trying to get a pure hip flexion. It is okay if we come out towards the shoulder a bit, because that's the normal line of the acetabulum. And I should be able to get to 120 degrees. So we're a little shy here. Okay? That's your glute max muscle length test.
So Dr. Rodriguez, are you, so your thumb is on the ASIS, but your fingers underneath are cupping like you find the PSIS, keep it there. Like you want that pressure to be in your hand the whole time.
Yep. So my fingers are at the PSIS, my palm is right behind the innominate. My thumb is just kind of hanging out, listening for things. I am not trying to stabilize the ASIS with my thumb. Right? It's just kind of resting there. All right? Therapist and patient.